Hello, my name is Nirav Patel. I'm an orthopedic surgeon at Johns Hopkins University. I specialize in hip and knee replacement surgery, and today I'd like to talk to you about an area of research interest of mine, returning to sport following hip and knee replacement surgery. As we all know, joint replacements are increasing in younger and more active patients. Patients therefore have higher functional expectations. Returning to sport specifically introduces biomechanical stresses on the implants that day-to-day use may not. As such, we risk wear, dislocation, fracture, and loosening of those implants, risking revision surgery. This is a study of mine looking at return to sport following total hip replacement surgery. We examined 7 studies out of 410 looking at return to sport outcomes, and 82% of patients returned to sport by 6 months. This generally centered around low-impact activities, such as walking, golf, and cycling. Prior experience within that sport was the strongest indicator of return to sport. Moderate-impact sports, such as doubles tennis, hiking, and skiing, were possible with prior experience in that sport, and barriers to return centered around surgeon recommendation, and the most cited complication was loosening. As such, it was recommended to avoid high-impact sports, such as singles tennis and running or jogging. Similarly, this study looked at 7 studies out of 268, analyzing return to sport, and we found that a wide range of patients returned to sport at 3 months, somewhere between 30 and 100%. There was a faster return to sport with unicompartmental knee replacement versus total knee replacement by about a week, and generally low-impact sports are felt to be safe. Moderate impact sports were also deemed to be safe as long as the patients had prior experience in that sport and it was discussed with their surgeon. And return to sport was more likely in those patients who are younger, with a lower body mass index, male, and also a lack of pains or joint problems in other joints. It was still recommended to avoid high-impact sports because of the risk of injury or complications risking revision surgery. In summary, my research has led to the following recommendations. Low-impact sports are generally deemed safe. Moderate impact sports are only recommended with prior experience in that sport and after discussion with the surgeon. High-impact sports are not recommended because of the risk of injury, but also implant failure risking revision surgery. Unicompartmental knee replacement has led to the highest return to sport rate at an earlier time frame. As such, I recommend consultation with ideally a dual fellowship trained joint reconstruction surgeon, both in joint replacement surgery but also sports medicine, such as myself. Ideally, there should be experience with up to elite level athletes. I would welcome seeing patients at my 3 locations here in Bethesda, Odenton, and Sibley, Washington, D.C. Thank you for your time.